Let me tell you a story. We had a 53-year-old gentleman who went to a pilgrimage. He had gone to a pilgrimage site, suddenly had severe head pain, collapsed while doing some sort of a puja there, and then was rushed to the hospital. He was taken care and he was diagnosed with a stroke. So they had a bleed in the brain. He was admitted in the hospital. He got operated in the hospital. He got stabilized in the hospital, and he basically had a right-sided weakness or a right-sided paralysis because of a left-sided stroke or a left-sided bleed. Now they've done a surgery, they've removed his skull bone because of the pressure that was developed. Hospital did an excellent job in managing him in the hospital and getting him from the jaws of death. Now, what happens later? After the surgery and he is fit for discharge, there is no active medical intervention going on, he is fit for discharge. But right now, the patient is paralyzed on his right side and he has lost his speech as well. Now, what can be done here? They have recommended him to undergo some sort of a rehab therapy. Now, such a patient, you take him home, he is going to be dependent, he is going to get depressed, and he is going to lose his value in front of himself in such that he is not able to perform his regular activities. He feels that he is getting dependent on the others. He is not able to individually sustain. This patient comes to our rehab center. Now, what do we work on? This is a long term. Rehab is not a short term process where you just walk into the hospital, 2-3 days, you take treatment, you're out. No, it doesn't work that way. We concentrate on getting a person back to himself, and we are giving him an opportunity to regain back his control over his life, over his activities, or what he can do or what he should not do. And we see to that the limitations are pushed to a limit. This patient underwent rigorous physio for the 2-month or 3-month period he was with us. He also underwent speech therapy and he went good amount of nutrition therapy and weaning out of medications that was done. This patient did not have diabetes, so he could recover a little faster. In the sense, when he got admitted, he was not even able to twitch his legs, no movement in any of his legs. Standing up was very far. For the aspect, even turning to one side was a difficulty. He was very enthusiastic, meaning he used to get up in the morning, take his breakfast, and or let's say he used to take a small meal, and then he used to be asking us, where is my physio session? So he underwent rigorous physiotherapy. Initially, it is more about stretching up the joints. Later, it involved stabilizing the shoulder and hip. And finally, it involved him taking a step. This involved assisted walking. Later on, it involved even independent walking. So this was a process which the physiotherapist him into confidence and helped him mobilize. So there are particular patterns on how they do. The physiotherapists are the best people to help in this aspect. Now, at the same time, he underwent speech therapy. His speech therapy, since it affected his speech center, it is going to take a much further time for him to recover well. At the end of his 3-month stay, he could utter a few words like amma, appa. He could utter like say morning, evening, small words. He could utter these few words, basically reciprocate or communicate with his children and his wife with respect to his needs. He came into the hospital with a Riles tube with a catheter on a stretcher. He walked out of the hospital by himself. He got out from his bed, took the lift, got down the stairs, and got into a cab and walked out of the hospital without any other tubing. This was in a period of a 3-month. So I'm not telling everybody will have the same result, but this is going to be different from person to person. So rehabilitation care is of prime importance, especially in that first 30 to 90 days where maximum recovery is achieved by the patient. Hopefully, this is not to trying to get you to our center or something like that. It is to genuinely inform you, saying that rehabilitation care is very important. It is equally important as the initial medical care that you receive in the hospital. Hopefully, this was useful. Thank you.